Good afternoon. It's been an absolute pleasure this week to see pictures of our youngest school children going back into school for face-to-face learning. The visible joy on their faces, on the faces of teachers and parents too, reminds us of the incredibly important role that education plays, not just for learning, but for that vital social interaction. And I want to thank again all our teachers, school staff, trade unions, local authorities and others for the huge efforts they've made in bringing children back into the classroom this week. We will of course be monitoring the situation closely, and as the First Minister said last week, we want to get as many of our learners back into school as quickly as we can, but also as safely as we can. So I want to turn now to the current state of the virus here in Wales and the latest update on our fantastic vaccination programme. On the first slide, you'll be able to see that the public health situation in Wales continues to improve thanks to everything that you are doing. Because of you, cases of coronavirus in Wales are now at their lowest level since the end of September last year. There are now around about 76 cases per 100,000 people. Cases are falling in most parts of Wales, and the R number is between 0.6 and 0.9, so continuing to reduce. At the same time, you'll see from the second slide, our vaccination programme continues at pace, thanks to the enormous efforts of everyone involved right across Wales. In the slide, you'll see we're represented by the green slide at the top of the chart. The very latest figures show that more than 878,000 people have had their first dose of the vaccine. That's nearly 28% of our whole population and more than a third of the adult population here in Wales. In the light of these facts and figures, I would talk a little more today about some of the important steps we're taking as we plan to open up other parts of society and the economy. Vaccination and testing are a key part of guiding us out of lockdown carefully and safely. Today, I'm announcing an expansion of workplace and community testing alongside even faster vaccine delivery to help Wales start to reopen safely. Firstly, on testing. We know that around 1 in 3 people who have coronavirus show no symptoms and may therefore spread the virus unknowingly. By frequently testing people in the workplace, we can identify asymptomatic people and their contacts faster, and crucially, help to reduce the spread of this dreadful virus. Regular testing of our health and social care workforce has already started, and we're now extending this testing to staff in childcare settings, schools and further education colleges. These plans will involve over 250,000 workers across Wales having access to weekly tests, using tests which produce results in under half an hour. Our new workplace testing framework, published today, extends this rapid and regular testing to public and private organisations with more than 50 employees. The priority will be workplaces that have a higher exposure to risk, those that involve people working in close proximity to others, and those that deliver key services for the people of Wales. And from next week, there will be targeted community testing. That will begin in parts of Bridgend, Merthyr Tydfil and Rhondda Cynon Taf. By expanding testing to detect more cases more quickly, particularly those who are asymptomatic, we may well see an uptick in the figures for the prevalence of the virus in Wales. An increase in the reported number of positive test results is not in itself necessarily a bad thing, if the basis for that increase is understood and swift action is taken to stop transmission. Our incredible vaccine programme is the other beacon of hope that will help to guide us out of lockdown. I can today confirm that we will offer the vaccine to all eligible adults in Wales by the 31st of July, as long as supply matches our ability to deliver and our ambition. And we are ambitious. Our revised vaccine strategy, which I will publish later this week, will set out how we will grow and adapt the places where vaccines are being administered as we move into the next phases of our programme. Our strategy update will also talk about how we will maintain high levels of uptake and increase our engagement with people who may be difficult to reach or initially reluctant to have the vaccine. We're currently moving through vaccinating priority groups 5 to 9. That's everyone aged between 50 and 69, everyone aged over 16 with an underlying health condition that puts them at an increased risk of serious illness with coronavirus, and many of our invaluable unpaid carers who provide care for someone who is clinically vulnerable to the virus. Now, subject to vaccine supply, we expect to have reached all these people by the middle of April. Within the last 30 minutes or so, the JCVI, the Joint Committee on Vaccination and Immunisation, has issued updated information about prioritising the vaccine rollout for those people with learning disabilities. As I stand here, my team are urgently determining how this information impacts on our plans here in Wales. We will, though, publish guidance today that will take into account this latest information from the JCVI, and that will help support vaccine uptake for unpaid carers and people with learning disabilities or severe mental ill health. The guidance will explain who in these groups is eligible for vaccine prioritisation and explain how we will identify, contact and support people to access their vaccine. Unpaid carers and those people with learning disabilities and severe mental ill health is a large group of people, and it may take some time for NHS Wales to offer appointments to everyone. But please be assured that our NHS is working as quickly as possible and nobody will be left behind. We've already set out revised plans for the careful and cautious reopening of Wales society and economy in light of both the accelerating vaccination programme but also the new threat from the emergence of new variants. We are of course examining the plans produced by governments in England and Scotland, looking carefully at their approaches and building on the shared scientific understanding of the latest evidence about transmission and variants. But we will always take decisions here in Wales in the best interests of the people of Wales. And once again, thank you to everybody at home who is doing the right thing and helping to keep yourself, your family, your community, and of course, to keep Wales safe. I'll now take questions from journalists. As usual, the answers will be broadcast on our social media channels. And the first question today is from James Crichton-Smith at ITV Wales.
Minister, thank you. You've already pledged money for mental health services because of the impact, obviously, that COVID is having on mental health. When can we expect to see tangible impacts on services as a result of that funding?
Well, I think that's a little circular, James, because actually as we're putting more money into those services in a variety of different ways, and of course my colleague Iechyd Morgan will set out more of the plans, the money we're pledging to go into the budget in the next year will need to account for the increase in mental health need that we know we've already seen and will continue to see. So that's, and you've heard Iechyd Morgan talk previously about crisis care. So there's a range of different strands, and Iechyd Morgan will be providing more information before we get to the end of March about what we expect to do with the money in our budget. We'll also then be able to take account of any further announcements made in the UK budget announced on the 3rd of March.
Thank you. We've spoken to a gentleman this morning called Luke who says that despite similar pledges from Welsh Government around mental health services in previous years, he's yet to see any really different impacts on services where he is. Now, I accept you can't talk about his specific case, but do you accept more generally that actually getting things changed takes far too long in Wales, despite money and pledges being relatively easy to put out?
Well, that's a very broad brush take on what happens here in Wales, James. We know that we've actually significantly changed a range of services, not just mental health, but physical health too. And actually the pandemic has seen a huge leap forward in the way we deliver services, the way people access services. And the necessity of doing that has actually meant that we think we're going to have a better way to deliver a range of our services into the future. If you just look at mental health, before the pandemic, we'd invested lots in what are called Tier 0 services. That's the lowest level intervention, make a really big difference to help support, sustain and improve people's well-being without needing to go into further levels of services for more serious mental ill health. And you'll also know the work we've been doing on our on our approach and programme with education, on addressing the impact of mental ill health concerns for children and young people. And you'll see the transformation project that we're funding in Gwent, but also the projects in North Wales as well that are looking at how we rework and reorder our whole system to be more interventionist at an earlier stage to support good mental health and well-being, as well as how we effectively address challenges at different points in the scale and severity, supporting the child and their family. So actually you see lots of improvement work that is taking place, but I would accept that anyone who is in a position where they haven't got the help that they want, the help to help them to maintain their life in the way that we would all want to, then I understand why those people would be frustrated if they can't see that impact in their lives. But I think objectively, James, it's undeniable that we've seen real improvements in mental health provision and services over the course of this term. And of course, there'll be lots of extra scrutiny about that as we reach the end of this Senate term and look forward to another one. I've now got Owen Clark from BBC Wales.
Prynawn da, Gweinidog Iechyd. You mentioned in your opening statement about publishing new guidance today on prioritising people with learning difficulties, severe mental illness and unpaid carers for the vaccine based on the updated advice by the JCVI published this morning. Can you be a bit more definitive about that in terms of the priorities within priority group 6, and also with your ambition now to vaccinate or offer a first dose to people under 50 by the end of July? What is your current position about the order of priorities for under 50s?
Okay, so for all those people by the middle of April, that's the people in groups 1 to 9. And with supply, if we have the supply in a predictable way where we can plan, then we should be able to resolve those groups with a first offer by the middle of April. I think people should have confidence in what we've been able to do in a vaccination programme to date. For all those other adults under the age of 50, we're expecting revised JCVI guidance to come out within the next few days, and we'll then have to respond to that. But we're confident in our delivery systems about being able to go through the volume of people that we're talking about by the end of April if the supply lines are there. Now, in terms of prioritisation within that broader group of adults under the age of 50, we're still waiting for the JCVI advice. We have asked questions, as indeed have other governments in the UK, about whether there should be prioritisation within that, whether in terms of the differential outcomes of people of different ethnic origin groups, also about occupational groups as well. And there's a challenge, isn't there, within that, about the simplicity of an age-based approach, and one that takes account of specific individual circumstances, and where that greater complexity and targeting would slow down the pace. So there are difficult challenges there, but we'll wait for that JCVI advice. When it's provided, you'll have a direct response from the government within a short period of time. When it comes to Group 6 that we're currently working our way through, the JCVI have provided some updated advice suggesting the use of GP registers for people with learning disability. Now, that will help to simplify many things. It certainly mean that people in residential settings with learning disability should be getting their vaccine, and that will allow that vaccination to take place. We're looking to work through to see if the GP registers actually cover all the people we'd want to see covered, because the definition we want to work with here is one we want to have on an inclusive basis. And we're anticipating the ability to have some clinical discretion about people who should be within that group. All of the people that are identified as being in that priority group, their information will go into the Welsh immunisation system, and that will generate appointments to go out to those people. The same perspective for unpaid carers. When we have the guidance that's provided, if we need to add people into that group of carers, then again, their information will go into the Welsh immunisation system, and those appointments will be then generated. Because we've also got this group of people with underlying healthcare conditions, including someone like me, I've got a chronic kidney condition. It's in remission, it's well managed, but that means that I'm more vulnerable to harm than other people in their mid-40s, which sounds a lot older having to say it out loud, but I really am in my mid-40s, and that means that I would otherwise be waiting until the summer. Now, I'm in that group because of that healthcare condition, so that's part of what explains why not just the age cohort in here, but those three quite large groups of people who are also in priority group 6 as well. That's why it will take time to work through, but people can expect to receive their appointment through the Welsh immunisation system, and they'll be invited by the NHS to come forward to have their vaccine. I encourage everyone to take up their appointment when it's on offer to protect yourself and, of course, people around you.
Diolch yn fawr for that. We, as well as you, have probably heard accounts of, harrowing accounts of people not being able to comfort their loved ones in care homes. When do you envisage people will be able to visit their loved ones and hold their hands perhaps on a regular basis going forward?
Well, I recognise this has been incredibly difficult for people who have not been able to see loved ones, for those people who have only seen them through windows or in a setting where the normal contact that we value so much has been interrupted. And that's even with the understanding that interrupting that contact has been a protective measure, because we've also seen the tremendous harm that's been caused if COVID gets into a closed setting, especially those closed settings where we're looking after our oldest and most vulnerable citizens. That's why they're at the top of the priority group for the rollout of the vaccine. Now, I can't anticipate in terms of a number of days or weeks when that advice is going to change, but it's not just about vaccination, it's also about our whole countrywide mission to suppress coronavirus as well. The lower the rates of the virus, the more likely we are to see changes made on visiting. Now, within the government, we will revise our guidance when it's appropriate to do so. We're looking at guidance all the time, so if there's a need to issue revised guidance, it'll come either from myself or from the Deputy Minister. We then need, though, individual homes to then open up visiting as well, because the government doesn't provide either a blanket requirement to ensure that every home is visiting. That's not within our statutory powers easily and reasonably, or indeed to prevent any home from having visits as well. It's already possible to have visits now, but the basis for those visits should expand. The other thing we're doing to help make it as safe a prospect as possible is we're providing lateral flow tests as well. We'll be able to make sure that potential visitors can have those tests before they enter a home. We've also invested in what we're calling pods to allow more visiting areas to be created around a range of homes too. So we're doing what we could and should, I think, to prepare for more visits to take place. But initially, even when more visits can take place, people should still expect some social distancing. And when it's safe to do so, then there can be physical contact. I just think it's the wrong thing to try to set out in a broadly optimistic timescale without the evidence to underpin it when that physical contact can safely take place. But I understand the real heartache this will cause for people living in residential settings as well as their loved ones who want to be able to have that physical contact. I've now got Peter Gillibrand from LBC.
Should my Gweinidog. Now, it's very reassuring news about learning disabilities and unpaid carers for a lot of people across Wales and also across England, as we've heard in the half an hour before your statement. But in a Welsh Government statement, you said the language of the JCVI on learning disabilities is rarely used in Wales. Why has it taken you so long to acknowledge this? And couldn't you have done this 2.5 months ago and saved a very anxious wait for a lot of families?
I understand the very real anxiety of families who've been waiting, but as you'll appreciate, Peter, you've been reporting on what we've had to do in a really short period of time in getting our vaccination programme up and running and making sure we had the scale and the ability to work as quickly as we've been able to, and working through the enormous number of practical challenges that has taken to work through groups 1 to 4. And we have been talking with people in the sector about how we recognise that the language in the JCVI doesn't really reflect the way that we are trying to support people with learning disabilities here in Wales. We've had to make sure that we land something that then makes sense and actually protects people, because I recognise that many adults with learning disabilities are much more susceptible to poor health outcomes in any event. It's why this government, with the leadership of the Chief Nurse, has had an Improving Lives programme for people with learning disabilities well before the pandemic. We also recognise that coronavirus is much more likely to cause harm for people with learning disabilities. So we've been working through that, and we have worked as quickly as possible. Now, I recognise that if you're someone in a family who's concerned about someone with a learning disability, it won't be much comfort to those people to hear that we really have been working as quickly as possible. People just want to know that the decision is going to be made and as quickly as possible. Today really is good news, and I hope it will give people lots of comfort about the fact that they can expect to be receiving in the very near future those appointments for them or their loved one to receive a vaccination, but also to be involved in some of the best interest conversation that will need to take place where people can't give practical consent. So we had to work through a range of issues, but as I say, I think this is good news today, and I hope it will give that clarity that people, I understand, have been asking for.
Now, England has given a detailed roadmap, as you know, and you've had a few days to look over the dates. And if the science says it's safe, are there any areas of restrictions you'd prefer to try and unlock in Wales at the same time to make things simpler for people?
Well, I recognise that simplicity and having common messaging across the UK would always be helpful for people, whether they're individuals who want to know if there are services they can use, or businesses and how those businesses will want to look forward to reopening. We were told about the UK plans and with some detail on the day that they were about to be announced. So we haven't been able to work through on a four-nation basis about the maximum amount of consistency. And you'll know that we've regularly said we want to be able to do that. Where possible, we want to be able to agree a joint approach. But England have made different policy choices. The advice on from the chief medical officers and scientific evidence advice isn't really any different within the UK. What England have chosen to do, though, is they've chosen to move away from the advice on having a more phased approach to school reopening, but to have, if you like, a big bang reopening on the 8th of March. And the consequence of that is they're having to have a bigger gap between that intervention and when they're next contemplating doing something else. We're actually doing something that is in accordance with the scientific evidence and advice that we've seen. You'll have heard the Deputy Chief Medical Officer speaking about it this week. A phased approach to schools and then a phased approach to other potential reopening as well. Now, I think forecasting much further into the future is fraught with difficulty and uncertainty. At various points, trying to give long-term forecasts has made a mug of a range of people, whether it's coronavirus sent packing in 12 weeks, a vaccine by September, or substantial normality by December. All of those things have proven to be long-term punts that haven't been that haven't fared well with reality. So we're doing something that is forecasting a reasonable amount into the future with a 3-week review. We'll be upfront about what that means, what the next review might mean as well, to give people enough time to get used to the practical progress we're making and to take account of what we're all managing to do together to help suppress coronavirus rates here in Wales. Thank you, Peter. I've now got Mark Smith from Wales Online.
Thank you very much indeed, Health Minister. COVID hospitalisations appear to be falling faster now than they have at any other point in the pandemic. Do you think this is demonstrating the impact of the vaccine rollout? And what impact is this having on your discussions around the easing of lockdown?
Well, the reduction in COVID mortality is really good news, but we still need to reflect that last week, several hundred people in Wales still lost their lives as a result of coronavirus. So good news to see a reduction in the amount of harm. There's still real and material harm being caused, which is why we're taking a cautious approach out of lockdown. It isn't entirely clear, even with the very good news about the studies produced both in Scotland and England on reductions in transmission and the impact that is likely to have in reducing COVID mortality. We can't be entirely clear still how much that reduction is because of the lockdown measures we've introduced and the high levels of public support that lockdown has had in terms of public doing the right thing, and I'm tremendously grateful to the people of Wales for doing so, but also then the increasing impact of the vaccination programme as we've been vaccinating those most vulnerable to harm. So we expect that in the future, I'd argue, if like a better answer as to what is the difference between the lockdown measures, the changes in public behaviour and support, the reductions in contact and household mixing, as opposed to the vaccine and what that allows us to do. But as we get more of that evidence, it will play into the choices that we're able to make about coming out of lockdown. We then have to have the counter challenge of a much more transmissible variant of COVID that is now the dominant variant in Wales and across the rest of the UK. So it's not a straightforward picture, but definitely the vaccination programme and reducing numbers of people losing their lives to COVID are good things, and they're a positive part of our conversations about the future.
Thank you very much indeed. And secondly, if England lifts lockdown restrictions more quickly than Wales, is there a fear that the UK government's furlough scheme will end too soon for many businesses here who rely on it. Could perhaps Wales be forced into following England's path, regardless of whether or not it agrees with their measures, as it doesn't have the financial means to support businesses on its own?
Well, that's a bit of a hypothetical question. We'll know more about what's happening because there's a UK budget coming up within about a week or so's time. So we hope there'll be clarity not just for the Welsh Government and other governments in the UK, but also for workers and businesses who are having to make choices with the imminent end of furlough at the end of next month. So actually from a business planning point of view, it's really important that a decision on furlough is made as soon as possible. Now, you know, the forecasting about whether the UK Treasury will act as the England Treasury first is something we've been through before. It's a Treasury for the whole United Kingdom. It shouldn't just be about looking at choices, different policy choices that might be made and that only affect England. Now, I think that for those people like me who actually believe the union of the UK is a good thing and should be a good thing in the future, if it's reformed and works for all of us, taking choices that look very much like an England only or England first approach is going to weaken those bonds in a way that I think goes well beyond dealing with the pandemic. But I hope the clarity is provided in the near future to safeguard the support that businesses and jobs require for the future, because this is an economic crisis as well as a public health one, and we've got a long job of recovery to do on both fronts over the next 5 years. Thank you, Mark. I've now got Steve Bagnall from the Daily Post.
Thank you, Health Minister. With the possibility of lockdown restrictions being eased in the coming months, has the issue of the border with England been looked at again? And can you give any update when people will be able to cross or meet up with relatives or friends either side? Or is any ban on crossing the border likely to remain in place for many more weeks to come?
Well, I think that depends on the pace of our respective rules in Wales and England. At this point in time, we may be moving to a stay local period. That depends on what we're able to do successfully over the next 2.5 weeks or so. If we're in a position to further reduce or further maintain the suppression of coronavirus, then we may be able to move from stay at home to stay local. That would be really positive. We'd have to think about what stay local means. England, though, are contemplating a move to stay local later than that. So actually, in terms of cross-border movement, it would be the law in England that would prevent people from moving either into England or from England into Wales. So that's part of the reason why the four governments need to talk to each other, as we have tried to, as we've been very open to doing so. And I recognise there are some border areas in both North East Wales, but also right across the border in Mid Wales and South East Wales, where the reality of community links and services mean that people cross the border as a normal part of essential day-to-day service. So there's a very practical part to this, not just about people travelling a much greater distance. So when we go in to think about if stay at home is going to come to an end, that is an if, what stay local might mean. And the same challenge would also be for the UK government acting for England only. If they're going to move to stay local, and of course there was some dispute about whether stay local was a good or a bad thing previously, but they've indicated that's what they're likely to do, but at a later point in April. So there are very practical decision-making points. For us here in Wales, we get to our next 3-week review, and then England gets to its next significant unlocking event, which they have planned for the 12th of April.
Thank you, Health Minister. And you've just touched on this. Obviously, Boris Johnson has indicated dates of April the 12th for domestic overnight stays and self-contained accommodation to possibly recommence in England, with international travel and possibly holidays after May the 17th. Is this something the Welsh Government could follow? Or will you put other plans in place for when people can travel for break domestically? Could it include people from England and beyond coming to Wales? And when can people in Wales be looking to go domestically or abroad for a holiday?
Well, the First Minister has indicated that we're contemplating the possibility of opening self-contained accommodation for Easter. That would be in line with the next stage of 3-week reviews. That would be slightly earlier than England, of course. We're contemplating that on the 12th of April after the Easter period. Now, if we're going to do that, we need to think about what the rules and the guidance is on travel and what that might mean. When it comes to that longer-term forecasting beyond the middle of April, I think you're very much into real difficulty. And it starts to feel not about a sensible approach that is driven by data, not dates. It looks very much like a date-driven approach. And to try to forecast what the public health picture will be then is starting to me to get into something that is more like astrology than science and public health advice. So we haven't done that. It's a deliberate choice. And as I say, you'll have heard the Deputy Chief Medical Officer earlier this week point out that trying to give that long-term forecast is almost impossible. I don't think it's the right thing to do. I'd be delighted if all of the stages in the English roadmap are possible, and we're able to jointly, across the UK, suppress coronavirus to the extent that that can happen. But I think the idea that we can have lots of foreign travel and foreign holidays in May is something that I have real concern about how realistic that is. You remember last summer, coronavirus was suppressed to 2 to 3 in 100,000. And yet we saw importation events from foreign holidays within Europe. You recall the Zante flight that was changed the rules in midair. I took that decision because I thought it was the right thing to do to help keep Wales safe. And we also need to look at the vaccination rates in other countries and what's happening there too. So, before we get into having the whole adult population having had their first dose, I think we need to have a pause and a step back and to look at the actual picture here in Wales and the rest of the UK, and then also to look at those other destinations who may, after all, not want to have that sort of unlocking and movement of people around their countries as well. So there's quite a lot to consider. Thank you, Steve. I've now got Tom Magner.
Thank you, Health Minister. Certainly our viewers will welcome your announcement earlier that guidance will be published today, because there's quite a head of steam and frustration built up. Can I just explore it a little bit further? On the one hand, at times you've said you're waiting for JCVI advice. On the other hand, you appear to say that advice needs clarification. I think it was in answer to an earlier question. Your guidance appears to have been delayed by pausing to define an unpaid carer and who should be eligible. I mean, how does this square with the fact that JCVI defined unpaid carers, albeit imperfectly, 2 months ago? Why has it taken so long to arrive at this welcome point? Is it, for example, disagreement between you, the Chief Medical Officer, and NHS Wales as to how to proceed, or a need to juggle vaccinations and locations, although vaccine supplies seem to be okay based on your vaccination rates? Be interested in your thoughts.
No, well, the initial guidance note that came with the JCVI we thought was overly restrictive. And you'll recall that from previous conversations we've had in these press conferences. If it had just been restricted to people in receipt of benefits and on a specific register, then we know we'd have missed lots of unpaid carers. And that shouldn't have prevented people who nevertheless have those benefits, where we understand and we have the information available to us, to have been invited. We've had a challenge, but if we use DWP data and a data sharing agreement, and that was actually practically very difficult. We do think, though, that we've got to a point by working with some of the national carers organisations, we'll have a more generous approach that takes account of people's duties and the impact not just upon them, but upon the person they care for as well. And that has just taken time to work through, and I should say that the carers organisations we work with have been supportive of our approach and the time we've taken to work something through with them that should work. Now that means that there'll be people who will be able to indicate if they think they're a carer, to make sure that they can then go onto a list, and then to have the immunisation system send out the appointments for them. I think better to have taken the time to get this right than to have done something and to have had to do something entirely different as well. And again, just as with people learning disability, I recognise there'll be frustration for people who have had to wait. But getting this right is the right thing to do. And I hope that everybody who is waiting for an appointment, whether you're an unpaid carer, someone with a learning disability, someone in the rest of Group 6 as well, or later on, will have confidence that Wales has moved very quickly in giving people their appointments when we've had the supply to do so. And we expect to have more supply available to us in March. So you can expect to see our vaccination numbers for first doses increase significantly when we get into March, as well as the numbers of those people that are now having their second doses as well.
Thank you for that. But doesn't the origin of all of this go back a lot further? The Social Services Wellbeing Wales Act 2016 imposed a legal duty on the local identification and support of unpaid carers. And we know from work by Carers Wales that this information only reached 7% of the population by last November, over 4.5 years ago. Before that, there was a law known as the Carer Strategy Wales Measures 2010 that put a duty on NHS Wales to identify unpaid carers. We know that the Welsh Government's carer strategy speaks of 4 out of 5 carers identified through health, but the 2010 measure was repealed when the 2016 Act came in. So in reality, haven't you had 11 years to create such things as GP carers registers, like the Learning Disabilities Register? And so couldn't you have acted a lot sooner before this pandemic?
Well, there's a complicated interplay between people recognising their carers, wanting to have an assessment of their care needs, because and you'll know this, Tom, from your interaction with unpaid carers themselves. Lots of people don't want to have an assessment of their needs as a carer, as well as those people who say they're frustrated when they do have it. So there's a challenge here about working that through. We actually have much more information on who an unpaid carer is because of the new laws that we've passed through and the approach that we've taken. And I think it's a really good approach to say, not just to think about what you do and the impact that has on the person you care for, but actually the impact upon you as a person with your unpaid carer duties. And so that's how I think we're in a better position with carers, then to make sure we're getting the right people through to get their vaccination. And the way that we set up our carer strategy and the work with carers was never really contemplated to be a means for people to access individual medical treatment, let alone a vaccination for a once-in-a-century pandemic. So we're trying to adapt the information we have in a way that is as agile but as accurate as possible. And as I say, I recognise there'll be frustration from people that's taken longer than you or I would have wanted, or anyone else who's actually waiting. But getting there to do the right thing, to have that clarity, will be really important now, but also to give people the comfort that they'll then get an appointment for their second dose as well. So the coming days and weeks, I think, will mean that more and more of your listeners and viewers will be getting their appointments, having their vaccine, and the good news is they'll then be in our system for the future as well. Thanks very much, Tom. Thank you, everyone. I look forward to talking to you again in the week ahead.